Even before the sudden surge of COVID cases this month, it was already mandatory to use face masks and coverings in public. It's one of several public health measures to reduce the spread of COVID-19.
Well, the actual purpose of wearing a mask is to reduce the transmission of respiratory droplets when we speak. A lot of times people tend to think that only when we cough or we sneeze, but it's more to prevent the respiratory droplets from touching or coming in contact with other people or surfaces.
Do you think that people are using masks for protection or to avoid consequences?
I think here in Belize, we're not really taking it seriously when it comes to actually protecting ourselves from this virus. I know everybody understands that it's a respiratory disease and it enters through a respiratory tract. But just the way that we look around and see how people keep right under their nose or always putting it down to speak, it shows that we're not really serious about protecting ourselves, but just trying to avoid getting charged and getting in trouble.
And if you step outside and pay attention to the masked faces around, improper mask use is still rampant despite the regulations and police enforcement. But even if you are using your mask correctly, is it helping? One recent study has revealed that not all masks and face coverings are created equal.
There was a study by Duke University that was actually meant to test the efficacy of the mask. And we found out that, of course, the N95 is the most effective, where they detected only 0.1% of respiratory droplets being filtered through the mask itself. And then there was, of course, the surgical mask that was effective. And thirdly, there was the three-layer or the cotton mask, homemade masks that were actually effective in protecting or capturing all the respiratory droplets.
It would have been easy to guess that hospital-grade masks perform better. But what about homemade and makeshift masks? There's been a flurry of cloth masks in the market, and some have opted to repurpose items like scarves, bandanas, and handkerchiefs.
The ones that failed miserably were the bandanas, those that use the handkerchief, and the neck beaters, the neck fleece. We found that the neck fleece of all was actually counterproductive when it came to protecting yourself and others, whereas in the simple optical measurement that Martin Fisher did in that experiment at Duke University, the type of material, the spandex, it actually causes the respiratory droplets to disperse into smaller droplets, making it very dangerous because the droplets are lighter, so they stay suspended in the air longer. And that makes it bad because the air can breeze and make it travel further. Control, which was the patient that spoke without a mask, they had less droplets recorded by the computer algorithm. So if you're going to wear a neck gaiter, you might as well not wear any.
When it comes to cloth masks, they did prove to be useful, but it depends on how it's made.
Face covering is not the same as protecting yourself from the virus. So picking or choosing the appropriate mask that filters or captures the droplets is very important. One that fits our face, one that's snug. A lot of times people tend to wear masks that kind of walk down when they speak. That's not very effective if it's not covering both your nose and your mouth. So the size of the mask, if you find that the mask is moving a lot, then you really need to adjust the hoops. The hoops are adjustable, so there's no, and it's not then cut it and pat it, so that it fits snug. If you're going to be using surgical masks, then it's very important that you understand that they are disposable, so they're not meant to be reused. The pathogens stay active in the filter itself, so the more you use it, the higher the concentration is. So you want to bear in mind that if you're going to use a surgical mask, you need to be financially able to buy one every day. So it's not feasible for everybody to use a surgical mask. When it comes to actually making your mask, then you want to, not everybody will be able to make cotton masks, but the layers is very important. So the CDC and the World Health Organization encourages you to use 2 cotton layers in a filter, or if you're not able to do that, then you want to make sure that the fabric that you're using is at least 3 layers. Because when we're wearing a mask, it's not only to protect ourselves, but to protect other people. And if we're using the right mask, then using the correct mask and practicing social distance would actually be effective in flattening the curve.
A proper mask with a right fit is only partial protection. Proper physical distancing and frequent hand washing should be practiced as well for the ultimate protection.